Good evening, everybody. We're just going to give it a minute more and give folks time to come in, but we wanted to go ahead and open up the platform so you could see that you're in the right spot. We'll see you in a minute. All right, at 6 o'clock, we're going to get started. Just to let you all know that County Council Chairman Teddie Pryor was going to be joining us. He's not here yet, so he wants to say a few words to you. So what we'll do is we'll hop into the program, and then when Chairman Pryor joins us, we will, if we're at a good spot, we'll bounce back to him and hear his remarks. But until that time, we're going to go ahead and get started. We have some really great speakers for you tonight. We have Dr. Chanda Funsell, who is the director of Charleston Center, which is Charleston County's Alcohol and Drug Authority. And she's going to be giving you some fascinating and very useful information regarding substance use services in Charleston County. We also have Ms. Jennifer Roberts. Jennifer is the executive director of the Charleston Dorchester Mental Health Center, located in Charleston County, serving both counties, Charleston and Dorchester counties. And Jen has a lot of information for you regarding 988 and some services connected to 988. I'm Debbie Blaylock. I am the Deputy Director at the Department of Mental Health for Community Mental Health Services, and I'm responsible for the 16 mental health centers across the state. So with all that being said, we're going to go straight to Ms. Jennifer Roberts. And Jen, we would like you to give us some information about the mental health center.
Debbie, before Jennifer starts, do you want me to give an overview of the Teddie Pryor Social Service Building? Or do we?
Let me defer to you. Do you want to wait for Chairman Pryor to do that when he hops on, or do you want to?
Sure.
Okay. All right. So we will go back to that. If he hops on, and if he doesn't hop on, then we'll go back to it, Dr. Funsell, and you can share all the information, very exciting information with everybody. All right, Jen. So first question, can you give us a short description of the Charleston Dorchester Mental Health Center and what it offers?
I sure can, and thank you, and thanks for everybody for coming. We're excited to be here tonight to share some good information for you. And I am going to talk a lot about 988 and those services, but I couldn't be here tonight without talking a little bit about our mental health center. So I did just want to let people know we serve children, adults, and families. We provide individual, group counseling, peer support, vocational services, entitlements. We have psychiatrists here that provide medication, nursing. We have teams that serve people in our clinics. We have outreach teams that go into the community and do homeless outreach. We have a variety of evidence-based practices here that we use in treatment for adults and children. And we have over 100 places you can find us and get services. And that sounds like a lot, but we are in a lot of schools. We're at DJJ, we're in law enforcement offices. We have a team at the jail. So we are in a lot of places. So access to services isn't hard, and you can either be served in our clinics or somewhere else. And I think the biggest takeaway to let you know about both our Charleston and our Dorchester clinics is that you can walk in anytime, pretty much before 3 o'clock, Monday through Friday, and get your chart open. So there is no waiting list. And if you are a parent of a child in a school, and maybe you want your child seen sooner and they can't be seen at the school that quickly, you can have them come into our clinic. So just wanted to share that information, and our main number is up here on the screen for you.
Thanks, Jen. Can you share some data with us regarding mental health crises in South Carolina?
Sure. So, you know, as we all know, that we've been in kind of a mental health crisis and drug and alcohol crisis, especially since COVID. A lot of people are suffering from anxiety and depression, and it's been kind of a very stressful time for folks. And lately, we've been pulling a lot of numbers, and it is a little bit shocking at kind of how much people are struggling. So in 2020, for example, there was approximately 1 death by suicide every 11 minutes in America. And for people aged 10 to 14 and 25 to 34 years, suicide was the second leading cause of death. And from April 20 to 2021, over 1,000 people died from drug overdoses. And John is going to give you more information about some drug overdose information about Charleston and the state of South Carolina when she talks too. But in South Carolina in 2020, there were almost 7,000 people who received care from the ER emergency room for suicide attempts, and almost 24,000 people who had suicide ideation that were seen in the ERs. So it is a big problem. And we know with kids being out of school, in and out of school during COVID, we've seen a big rise in obviously kids being able to deal with the anxiety and stress of going back to school. So it is a time where we do need more and more mental health and alcohol and drug treatment.
Thanks, Jen. So on July 16th of this year, 2022, the number 988 was launched. So Jen, can you tell us a little bit about 988 and what it's for?
Yeah, 988 offers 24/7 access to trained counselors who can help people who are experiencing suicide, substance use, or other mental health crises. It's someone to talk to anytime. And here in the state of South Carolina, Mental Health America in Greenville has been managing the Lifeline, which has changed to 988 in July, as Debbie said. And they've been answering all our calls here in South Carolina. There's 988 centers across the whole country. The goal for the nation is to add 988 call centers so that every state can answer its own calls. And why is that important for every state to answer its own calls? Because right now, if you call 988 and it does get rolled over to, let's say, Phoenix isn't going to know the resources that we have in South Carolina as well as we know the resources here. So the goal is to add enough call centers across the nation so that each state is managing their own calls. Right now, Mental Health America answers about 75% of the calls that come in for South Carolina. So that means that the calls then rolled over to another state to get answered. So what are we going to do to try to help that here in South Carolina? Well, Charleston Dorchester Mental Health Center and the Department of Mental Health is opening the second call center for 988 in early 2023. The goal is for us to answer the other 25% of the calls so that we can easily set people up with resources here in our state, and we obviously know better what's going on in our state. 988 will continue to grow and evolve in the coming months and years. There's a lot of federal investment into 988, and it's increased 18-fold from 24 million to 432 million for this national priority. They're going to build upon an existing national suicide prevention lifeline, which has actually been in operation since 2005. I think Mental Health America has been managing the lifeline here in South Carolina since about 30 years. So in the whole nation, there's over 200 independent crisis centers answering 988 calls. So you can call 988, or you can text or chat 988. So to text, you can just text 988, or you can call 988, and the chat number is going to be at the end where I have a lot of resources for numbers for you to call.
Thanks, Jen. Chairman Pryor, hey, good to see you. Are you comfortable with Jen finishing her questions, and then I will bounce to you to talk about the building? You are muted.
I'm sorry, but I had to get my granddaughter to help me get on. I was trying to get on. I could hear everybody talking, but now I can see. So, I'm not as good with this new technical stuff as some of y'all are, but I'm glad to be here.
Welcome. Are you comfortable with it, with Jen finishing, and then we come back to you? Is that okay?
Yes, yes.
Okay. Yeah. All right. Thank you, sir. We will do that. All right, Jen, you want to tell us how 988 differs from 911?
Okay, so there's actually, and now we do have a slide for this. I think it might be the next slide. Maybe. No, I'll just go, you can go back. I'll tell you anyway. We'll get to that. So yeah, so there's three options for you to call really in South Carolina. Or so 988 is an option, 911 is an option. And then we have a statewide mobile crisis call center that also is an option for people in crisis. So people say, well, which one should I call? Well, if you're having a medical emergency and it's imminent, call 911. If you are having a psychiatric emergency or mental health crisis, we want you to either call 988 or call the Mobile Crisis Call Center. Right now, we're working together in the state with 911 and 988 and our mobile crisis teams to figure out how to pass appropriate calls when necessary, because sometimes 988 will pass a call to our mobile crisis call center if we want to deploy a mobile crisis team to the scene, or 988 might even pass a call to 911 if they realize that they need first responders responding quickly. So there are three options, but really 988 is kind of the mental health crisis line, as well as mobile crisis is also a mental health crisis line. So I guess the good news is you have a lot of options if you need help out there.
Thanks, Jen. So when a person calls 988, what should they expect?
They should expect a trained counselor to answer the call. They'll ask them questions and try to figure out whether they need help. They want somebody sent to help them or not. They kind of help them. You can talk to a counselor for a while. It doesn't have to be an emergency. They can kind of safety plan with people and figure out what you can do to take care of yourself when you're feeling suicidal. They can also connect you to 911 if you want, or mobile crisis if you want. They will not automatically pass calls to our mobile crisis team without people's permission. So it really is, it's been proven to work to help people become less depressed, less suicidal, less overwhelmed, and more hopeful. And they will stay on the line and talk with people and to try to help give them resources and help them feel better.
So Jen, you talked a lot about mobile crisis. Can you tell us exactly what that is and what a citizen would expect if mobile crisis is called to the scene?
Okay, so we do have a mobile crisis team in the whole state of South Carolina. I'm kind of focusing on Charleston today because we're talking to the crowd in Charleston. But yeah, if we do have a mobile crisis call center that people can call if they are having a mental health emergency. Again, the people who answer that line will try to determine whether or not we can safety plan with people and make sure they're safe, and then maybe connect them with resources the next day. Or they may decide, and the person may request that mobile crisis come out and do an assessment on scene. And this is 24/7. So somebody can call and say, I need somebody to come out here and help us because I'm really worried about my daughter or my son or my neighbor. And mobile crisis will respond. They will respond with law enforcement just for safety, but nobody's going to get arrested. They really just have them there just in case they need them. But mobile crisis will go to the house or wherever it is. They'll do an assessment with the person. And if they can safety plan and kind of come up with a way for people to be safe, they'll do that. And if not, they'll help people get to either a hospital or an emergency room. Mobile crisis also does a lot of work via telehealth using video. So EMS will often call us or law enforcement and ask us to do a video call. So mobile doesn't even have to go out to the scene. So we do a lot of video calls here in Charleston with EMS and law enforcement, but they're there to help. They're there to help figure out solutions to keeping people safe. They also do probate screenings for the probate court to help people who need to be in a hospital for help. One of the things that's great for us here in Charleston is we have a really long relationship with law enforcement because we've had mobile crisis for 35 years. Law enforcement drops people off to our center or our crisis stabilization center as a jail diversion option. And so that's nice for folks who've been picked up on the street that would have gone to jail, and instead they can come to our mobile crisis team. And they also just help coordinate care with people after we've had calls. We call people the next day, we check on people, and we try to make sure they're safe. And I can say in our fiscal year 22, which is runs from a July to June, we did 1,234. I'm actually not to that slide yet. Emergency room diversions. We diverted over 1,000 people from hospitals, and we also kept 126 people from being taken to jail. Now you can go to the next slide. Yeah, and here's some just information over the past several years about mobile crisis calls, and TH means telehealth. So as you can see, we do a lot of telehealth calls here in Charleston, and a lot of face-to-face mobile calls. We opened our mobile crisis call center here in October of 2020. We actually took that over from Mental Health America. And since we've opened it, we've had almost 50,000 calls to our mobile crisis call center.
All right. So Jen, last question. You talked about with 988, it's a number to call, 988, people to respond, mobile crisis. And the last leg of that safety stool is a place to go. Can you tell us about that?
Sure. So the place to go part is about having crisis stabilization units or other alternatives to hospitals and jails. So here in Charleston, we do have the only 24/7 crisis stabilization unit. It's in the state right now. It's a 10-bed voluntary unit for adults. It's right now it's located downtown in Charleston Center. And I know Chairman Pryor is going to talk about the new location where it's going to be. It will be housed in the new social services building, which we're very excited about. But the purpose for it being there is to divert people from hospitals, emergency rooms, and jails. And police can drop people off to this unit. People can come in and say, hey, I need help. And it's for people who are voluntary, which means they don't have to be in a hospital. We're not so concerned about them that they can't leave. So it's a place where you can get treatment. You can get peer support services, medical services, nursing services, a shower, and a meal. So it is a great option also for kind of stepping down from a hospital, or people who are coming out of jail that we're still trying to figure out resources and services for them, maybe housing. They can also come to the Crisis Stabilization Center for a day or two until we kind of get that figured out. And in South Carolina, the plan is to open 8 more crisis stabilization centers across the state. And we have one in Spartanburg right now. That's a kind of a partial CSU. It's open part of the day. It's not an overnight unit. But we have 3 other mental health centers right now that are in talks with their communities that have a site selected. And we have a few more mental health centers who are also talking to their communities, but they haven't got a site selected. But the crisis stabilization units are kind of the next step to the continuum of crisis care that 988 is about. The final step is kind of wraparound follow-up services to everybody that we see, either in crisis stabilization units with mobile crisis at Chanda's Charleston Center, or people who've called 988.
Thanks, Jen. And this slide says that currently the TCSC is closed, but I think that's from an old.
Oh, oops.
So it is
Yeah.
open. Correct. It is open.
I didn't catch that one. Sorry. Yes, it is totally open, and I will correct that one.
Okay. Jen, anything else from you before we go to Chairman Pryor?
No, I think I'm good.
All right. Thank you. All right, Chairman Pryor, welcome. So would you like
Thank
to
you.
hear some words?
Yes, first I want to start off by thanking everybody for being here on tonight for this CJCC forum, which is hosted. And I want to apologize for coming on late, but I was trying to get on and doing all this technology, and finally I figured it out. But we're very excited to learn about what's going to be coming to the Teddie Pryor Senior Social Service Hub. And before I begin, though, I want to officially congratulate former Judge Ellen Steinberg on her selection as the new director for the Criminal Justice Coordinating Council. Ms. Steinberg has decades of experience in the law profession and the criminal justice system, as well as a wealth of experience working as an executive board member of the CJCC. Ms. Steinberg, I know you will help build on the CJCC's foundation that was started by Christy Danford and others in 2015. I also want to thank Ms. Danford for creating the framework for the CJCC and her dedicated service to Charleston County CJCC and this community. Now, to begin tonight's forum, I know you have introduced a few people, and I don't want to be repetitive, not unless you want me to, but I think the panelist has been announced because I heard that on the way coming in. And so, again, I want to thank also Chief Deputy Eric Watson, who is, on our side on the county that oversees this, who's been doing a great job in working with, the CJCC and getting this all started and all, running up to par. So, Ms. Baylock, I'm going to turn this over to you at this time, since everybody has already been introduced to the panel. And again, I apologize for the lateness.
Yes, sir. Thank you for being here with us. And we have some questions for you. So we're
Okay.
super excited about this building. Can you tell us where it's located?
Well, the physical address is 3685 Rivers Avenue, but it's located on the corner of Rivers and Macmillan Avenue. This is a centralized location because, we felt that it'd be easier to access, better for people who lives that make sense. The hub, will be sitting right next to the new Keith Summing Library, as well as the new Carter Hub that's been planned there. And it's on the mass transit rapid line. And so County Council made this investment in a location for our citizens, which I think will benefit greatly.
Yes, sir. Thank you. Now, can you tell us what agencies will be housed in the building other than Charleston Center and the Charleston Dorchester Mental Health Center?
Okay, so, we will have Charleston Center for DeOtis, Tri-County Crisis Stabilization, Department of Social Service, DSS, Department of Health and Human Services, DHHS, and DHEC Health Clinics and Administrative Offices. Those will be located in the building.
And what vision do you have for this resource to the community? Since it's carrying your name, what would you like to see it produce?
Well, the hub was established for one purpose, and that was to provide centralized services, including inpatient drug treatment and mental health services in one place. This kind of one-stop shop for social services is a big step for us, and it heads us in the right direction for our most vulnerable citizens. The Social Service Hub will create better access for citizens and better opportunities for public services to reach deeper into the community that needs public assistance the most. And again, I think this is going to benefit the area a whole lot because, that area needs revitalization. By having this there, a lot of folks, I think, will have access to walking as well as catching, the transportation hub to come there.
Thank you. Is there anything else that you'd like to share about the building before we move to Dr. Funsell?
Well, I'd just like to thank everyone, for their commitment to making our criminal justice system more of a restorative process. It's rewarding to see CJCC bring professionals from different backgrounds together to discuss solutions to mental health and to substance abuse or substance use. Mental health and substance abuse has been a problem in our society for decades. This type of social service issue requires serious conversations with real solutions. Together, we, the community and the county government, can work to find viable solutions. So here again, I think what we're doing here is a big step and a big start. And I think this would be a role model for other cities probably to kind of see what we are doing to maybe, follow up what we're doing in other areas, and other cities and other counties to make things happen, because this is serious times and serious days. And as you know, we just got out of a pandemic, not completely, but a lot of people needs help, and this will help us to be able to help them.
Yes, sir. Thank you very much. I think you're exactly right. I have the privilege of being in every community across the state and covering all 46 counties. And what is happening in Charleston, I do think is a model that can be replicated in other cities across the state. So thank you very much for that. Awesome. Okay.
Well, thank
Dr.
you so much.
Yes, sir.
I have to leave because I got another engagement, but thank y'all so much.
Thank you for being with us. We
You're
appreciate you.
welcome. All right.
Thank you, Chairman.
We
All
appreciate
right.
your
Bye.
service.
All
Thank
right.
you.
Bye-bye. See y'all.
So Dr. Funsell, your situation is a little different than Jennifer's. All of your operation is moving into the building, whereas in Jennifer's circumstance, it's the crisis stabilization unit only. So can you tell us what substance use services will be available within the Teddie E. Pryor Senior Social Service Building? That's a mouthful.
It is a mouthful, and I hate that the chairman had to get off, but I understand his schedule is very busy, so I am honored that he was able to join us for when he could. But county council and the chairman has been working for years to get us in a good location. In fact, we often joke how I've been packed up to move since December of 2014. So this has been a long time coming, and county has really worked hard, and council members have worked hard to build a beautiful, beautiful building in the community that's really going to help remove barriers that are in place for our patients. Right now, they have to go across town for mental health, come down here, go to North Charleston to go to DSS. There's all kinds of barriers in place that impact access for care, and this will help create more of, as chairman said, a one-stop shop and remove some of those, and it'll create that kind of no wrong door mentality and allow us opportunities to do some multidisciplinary treatment teams. And so this is an incredible opportunity for us to really work together and remove some of the silos to help support our community. So for the Charleston Center, all of our services are moving. So we've been downtown since 1999, and all of our services we provide in this building will be located over at the new social service building. So we have the full continuum of care, starting with withdrawal management, which people are more familiar with the term detox, which is usually a 3 to 5 day stay for people that need to go through detox in order to medically get the drugs or alcohol out of their system. Medically, you only need to go to detox for alcohol use or benzodiazepines, but we also take people into our detox that have other substances in their system. So we do take a lot of people that have opioid use disorders as well. And then we also have 2 residential programs. We have a New Life Unit program, which is a mom and baby unit, and that's a 16-bed unit, and our detox is a 16-bed unit. But our New Life Unit program, our mom and baby unit, is an average length of stay for about 90 days, and that's where our moms and children will get some intensive support to start them on their recovery journey. And there's specific criteria through the Diagnostic Statistics Manual, as well as the American Society of Addiction Medicine patient placement, that we determine whether someone needs detox or the residential services. The other residential program we have is the Transitional Care Unit, and that's a co-ed unit that will also be 16 beds. But it's a co-ed unit, and the average length of stay there is 28 days to 4 weeks. And then we also have intensive outpatient and outpatient services for adults and adolescents, which includes some specialty services, such as women's only groups and trauma-focused groups. We have the ADSAT program that will be there. So people who have received a DUI and they have to take a certified course in order to get their license back would enroll in our ADSAT program, and that stands for Alcohol Drug Safety Action Program. The PEER program is not going to be located at the new social service hub. It'll be close to it. So the PEER program is persons incarcerated entering recovery. And that's our jail program, where we have a 64-bed men's unit and a 12-bed women's unit at the detention center. But why I added that to the list is because our peer support specialists and our staff at the detention center will be working on the warm handoff back into the community to help with that reentry process. We also will have adult drug court groups at the new building, as well as some specialty programs such as the alcohol education program, which is a packaged education program, parenting, anger management, and we also do what's called PrEP, Palmetto Retailers Education Program, And that's where we work with retailers in the community to help prevent underage sales of tobacco products. We also will have prevention services there. So our prevention staff run the PrEP program. They also go into a lot of our schools and communities to raise awareness around substance uses and misuse. We'll have medication-assisted treatment services, which is our opioid treatment program. So our methadone clinic, which is part of our opioid treatment program, is the longest running methadone clinic in the state of South Carolina, and that's been running since 1979. So we do all 3 FDA medications there for opioid use disorders. And then we also provide medication-assisted treatment services to our specialty courts, and we help support the detention center and support all of our programs with MAT. So it's not just our methadone clinic. We also have harm reduction services. So one of the things we do with harm reduction services is we do Narcan distribution. So we try to get as much Narcan out to the community to help save lives. We also have a urine drug screening lab that will be in the new social service hub. We also do HIV screening, and we'll start back doing Hep C screening at the social service hub. We have peer support specialist services there. So we have, oh gosh, I think we have 5 peer support specialists now that work with everybody in our program and also works in the community and supports some of our post-overdose initiatives with law enforcement and other first responders. And these are individuals with lived experience who can share their message of strength and hope in their recovery journey with others to help engage patients into their recovery journey. And then the last program we'll have there is our admissions services and triage services. And that's where we do our assessments. And we have our helpline, which is a 24/7 helpline where I'll share that information with you on one of the screens on how to access services.
So Dr. Foncel, incredibly robust services, sounds excellent. How does one access these services? How easy is it? How quick is it?
Great. So good question, because you hear about all these services, but then like you said, how do you get there? Jen talked about how you access some of those crisis services related to mental health. And so for us, again, 988 supports both mental health and substance use disorder support, but we also have a helpline that's 24/7, and that's 843-722-0100. We also have, you can call our general office number 958-3300, but that's not a 24-hour number. The 722-0100 is. We also have a website and an email that you can reach out to ask for help that way. And then we do have scheduled assessment hours Monday through Friday. Now, while these assessment hours are scheduled, we also will take walk-ins outside of these hours. So if somebody comes to the building needing help, someone will talk with them and help review some of the services and maybe do a quick screening while we work on getting their assessment coordinated.
Thank you. Can you tell us about the substance use trends that you are now seeing in our community?
Yeah, so Jennifer talked about the increase in suicides, and from where my area of work in drug and alcohol, throughout the pandemic, we were and continue to deal with the opioid epidemic. So in Charleston, well, nationally, the number of overdoses has reached 107,000 overdose deaths. And I think that's the highest number our nation's ever seen. And every year, particularly since the start of the pandemic, that number has just increased. And so every year we hit the highest number our country's ever seen. And we're seeing that same trend here locally in the state of South Carolina, as well as in Charleston County. Some numbers we have, I use a platform called Overdose Detection Map, or ODMAP, and DHEC, law enforcement, EMS enter data into ODMAP as well as the coroners. And that's a way for us to track real time what's happening in our community regarding overdoses. And I pulled up ODMAP today just to kind of take a look at some of our numbers. And In 2021, some preliminary data shows in Charleston County, we had over 183 fatalities. In ODMAP from January 1st, 2021 to January 1st, 2022, we had 1,380 overdoses. So 1,380 overdoses compared to 865 the previous year. So that's a huge increase. To date, for this year, we've had 1,189 overdoses, 148 of them being fatal, compared to 886 overdoses same time last year. And nearly 83 of those overdoses involve fentanyl. So fentanyls are a main driver of overdose in our community right now. And it's because it's so much stronger. It's 50 times stronger than heroin and 100 times stronger than morphine. And a lot of people don't know that it's in their drugs, and it just takes a tiny amount where people think they're taking heroin or they think they're taking cocaine. What they're really getting is fentanyl. So that's really driving our overdose deaths right now, the synthetic opioids, and particularly fentanyl. And then we are seeing an increase in xylazine mixed in with some of these other drugs. And that's been particularly mixed in with cocaine, and that has increased overdoses. Unfortunately, with the xylazine and cocaine, because xylazine is a horse tranquilizer, Narcan does not reverse that kind of an overdose. But with fentanyl, with multiple administrations of Narcan, we can reverse those overdoses and save lives. And we're also, because we're seeing this huge increase in overdoses in our community, we're working really hard on doing a number of post-overdose follow-up initiatives. So one of them is our Addiction Crisis Task Force, which is made up of judges and lawyers and U.S. federal drug courts, U.S. federal attorneys, and probation, pardon, parole, our schools, our hospitals, treatment organizations, recovery organizations. We're all working together to try to figure out how we can support our community. So we do overdose fatality reviews or case reviews presented by law enforcement, where we really look through a case to see what happened, how we could have better supported that individual or that community, where could we intervene differently. We also are working on a community overdose response plan. So when we see a spike in ODMAP, what kind of alerts can we get out to the community to say, hey, there's a really bad batch of drugs out there, pay attention to this, and put notifications out everywhere we can. We've put together quick response teams. And so when somebody overdoses, we'll follow up with a post-overdose follow-up with law enforcement, or a community paramedic and one of our peer support specialists to go visit that individual if it was not fatal, and do some Narcan training and give them a Narcan kit as well as information about how to access treatment. And we worked collaboratively to write a COSAP grant, which is through the Bureau of Justice Assistance. So this COSAP grant was awarded to the City Police Department in order to put in critical incident management software system that helps us better track follow-ups with individuals to hold us accountable for following up, as well as embed peer support specialists in our law enforcement system, which is pretty incredible to have peer support specialists embedded there. And I'm really also excited that our mayor's office is also working to have peer support specialists with the homeless outreach. And then we also do a lot of Narcan distribution. So because overdoses are so high in our community, we're trying to do Narcan saturation. And so to date, we've handed out over 61,000 doses of Narcan. People will get 2-dose kits, so that's over 3,000 kits, and they're free to the public. And we'll do some training and give you a kit. And if you use that kit and you need more, you can come back to us and we will give you more. We work with our law enforcement to go out into the homeless encampments to give out kits as well. And we will continue to do so for as long as we can. So a lot of really important trends to pay attention to support our community who are being significantly impacted by all of these overdoses and overdose deaths.
Dr. Fensel, did you mention that fentanyl is actually being laced in marijuana these days?
It is in everything. So where a person thinks they're taking cocaine or methamphetamine or even marijuana, or if they're thinking they're taking an opioid pill or a Xanax or Valium pill, oftentimes those are pressed or cut with fentanyl. And the reason why people are cutting it with fentanyl is because it only takes a tiny amount of fentanyl to get the high. And so dealers can cut their drugs with fentanyl to extend their supply. And fentanyl is cheaper than heroin. It's smaller, so a little bit goes a long way. It's easier to smuggle. It increases potency, so it actually gives dealers a bigger profit because they can have triple the amount that they would deal when they can cut their and extend their supply with the fentanyl.
Thank you. All right, so now I have a couple questions for you too. Unless Dr. Purcell, do you have anything else?
That's all I have. Thank you,
Okay.
Doug.
I have a couple questions for you both. So Jennifer, what does it cost for somebody to be seen at the mental health center? Does a person have to have money? Is it free? Tell us about that.
Yeah, we will see people regardless of their ability to pay. We do serve people with Medicaid and Blue Cross Blue Shield, but it doesn't cost anything. We have a sliding scale for folks who don't have insurance. We have entitlement specialists here that'll try to help people get entitled for services, to be able to pay for services. So if you don't have any money, that is never a reason not to come.
Dr. Purcell, same question.
So pretty much the same answer as Jennifer provided. We provide services to individuals regardless of their ability to pay. We can set up payment plans with people with as little as $5 a month. We also write off people's accounts if they haven't been able to pay. We also, for ADSAP, if they don't have the money for covering the enrollment costs in ADSAP, which is $500, we'll have them do community service around the building in lieu of having to make payments. We also work with insurance companies, Medicaid, Medicare, Blue Cross Blue Shield, and other managed care organizations. And we also get block grant dollars to cover indigent expenses for people that are deemed indigent through a financial assessment and have no ability to pay for their services.
All right, thank you. Here's another question for both of you. I'll bounce back to Jennifer. So particularly for crisis stabilization, you referenced that it can be used for jail diversion. So do we need to be worried as a community that you're going to divert somebody who committed a violent crime from jail into crisis stabilization?
No, you're definitely not going to have to worry about that. You know, it is a diversion for people with low-level offenses, usually trespassing and things like that. But definitely, we don't want to divert anybody who is doing violent crimes from jail. What we want to divert from jail, and I probably can speak for Chanda too, are the people that have the lower level crimes that really need treatment and they don't need jail. Jail is not a place for treatment. And unfortunately, a lot of our patients and Chanda's too, they do end up in jail and they do have very low level offenses and they need treatment. So I can say, I'm happy to say we in Charleston, all of our law enforcement here support that idea as well. And we have several jail diversion and deflection things going on with the CJCC and lots of agencies working together to try to figure out how to get the right people in jail and the right people in treatment and make them not have to go to jail. So definitely not, we are not taking anyone out of jail that shouldn't be in there because they present a danger to society.
Dr. Purcell, did you want to add anything to that?
Just the same response as, you know, some of the people that are put in our detention center are there on low-level offenses and they're in just pretrial status. They don't have money to pay their bond. They're waiting for court, but they could have very low-level offenses. And individuals are oftentimes better served being treated in the community than they are languishing in our detention center. And so we're here to help our law enforcement and our detention center to help people be treated in the community when they can, and then for people with higher, more violent crimes, you know, making sure that they're not in the community and putting our community at risk. So we work really closely with law enforcement. I do get a lot of calls and emails from law enforcement that says, hey, I ran across this person. Can one of your peers come out with me and we do a wellness check on them and just get them a Narcan kit and try to get them some help? Or one of the law enforcement officers will send me, hey, we just put this person in the detention center, but they really look like they could need some help. Can you reach out to them and see if they're interested in treatment? So a lot of our law enforcement officers that we work with really want to help the individuals in our community get connected to my services or Jennifer's services. And I do just want to add, Jennifer's talking about mental health and I'm talking about drug and alcohol, but our patients are one and the same, because the majority of people with mental health disorders also have substance use disorders, and particularly those that are incarcerated. And I think that percentage is almost over 70%. It's a very high number. And a lot of people that go into crisis stabilization, the beauty of it being housed in alongside with drug and alcohol, and it'll be on the same floor as our detox and residential, is because oftentimes when a person is having a mental health crisis, they also may be intoxicated, or if someone's coming into my detox services, they also may be in a mental health crisis. And so I need crisis support. And so we already work hand in hand now, and this just further strengthens our work together. But oftentimes community talks about these populations as being separate, and they're really one and the same.
So Dr. Funsell, great segue. Looks like you're reading my mind. So we know from years of evidence that states that have a no wrong door mentality, meaning that a person who's living with a substance use disorder or a mental health disorder should be able to pop into either of your doors and be able to get the help they need. How true do you, each of you, what is your perspective on that? How true do you think that is in Charleston? I'm not going to ask you to reference the rest of the state. I'm just going to ask you to reference Charleston. So
Charleston's special compared to the rest of the state because we got that early on. In fact, we have a training consortium with our two agencies, and we are the only training consortium in the state where we have been co-training our counselors together for, gosh, it's been almost 10 years maybe, or longer than that.
Longer than that.
Yeah.
Longer than that, yeah. Where we co-train our counselors together so that they both have a grasp of best practices for people with co-occurring disorders or mental health or drug and alcohol, so that they can be equipped to have that true no wrong door response and to be comfortable with knowing each other as counselors so that we can reach out to each other for support.
So we have, thank you. Jen, did you want to add anything to that?
No, I just to brag that, you know, I am glad that we're Charleston because, yeah, I mean, I often laugh thinking that Dr. Funsell can do my presentations for me and maybe I can do them for her. That's how much we work together. We're very lucky in that sense in Charleston, and that is right. All these patients, they're both of our patients. They really are.
All right, thank you. So we did get a question from the field. I answered the question directly, but I would like to raise the question because others may have it also. So if a person is homeless, can a person who is unsheltered and living in homelessness, can that individual access either of your services? And could you tell us how that would happen? And Jen, I'm going to ask you to go first. And if you would step out of the Teddie Pryor social service building a minute and talk about some of the other services for those living in homelessness and how they can access, and then we'll get Dr. Funsell. She referenced some of it, but she can expand upon that.
So sure, definitely. We actually have a team of people that reach out to the homelessness. In Charleston, we call it the PATH team. And we have folks working down at the Navigation Center and soon to be the Hope Center. But we have bachelor's level counselors, peer support counselors. And when we get our position filled, our master's level counselors back, but they're going out with City of Charleston staff, and they go to the homeless places where where folks are living. We try to get them engaged in treatment. A lot of patients that go to the Crisis Stabilization Center are homeless, and you can start services there, or you can start services here. We have a lot of programs to try to help people get housing. Unfortunately, housing is a whole nother hour or 5 presentation on the amount of housing we need in Charleston, because that's probably one of our biggest challenges. But we do have ways to help fund people with housing. We have a home share program where people can live with families, and we can help pay for their housing, and we can help people live in residential care facilities. So we have several outreach. We have a pharmacy program that we try to reach out to, not just homeless people, but people who live downtown that need the additional help, where we're giving out fruits and vegetables. And Chanda goes out with us there. Those are on Wednesday afternoons at Mall Park, where we're giving out fruits and vegetables, but we're trying to connect everybody with services with us, with Better Clinic, with EMS, law enforcement are out there. We're just trying to do everything we can to get the information out about what we do have to offer. But definitely we more and more we are adding to the groups that are going out to the homeless population and trying to help them.
And Jen, correct me if I'm wrong, but don't you have a mobile unit that goes to 180 Place?
We do. We have our RV. So we do have an RV that goes kind of out to rural areas of Charleston. Initially, it was designed to go to places where people couldn't get to us, like Edisto and McClellanville and in different other areas. But it was needed so much at 180 Place. It does park at 180 Place like 2 days a week. So a lot of folks are being served in the RV for treatment. And when we do have people down at the Navigation Center, we're also, that's another place you can start services with us. In Dorchester, actually, we have a homeless outreach team that's going out with law enforcement and trying to do the same thing up in Dorchester. So it's definitely an area that we're spending a lot of time trying to connect with folks and let them know we're here, and we are here to help.
All right, Dr. Funsell, you want to add anything about the homeless outreach?
We work together very closely. We don't have as robust of outreach to the homeless population as mental health does, but we work alongside mental health and law enforcement and our hospitals. We treat anybody, regardless of their housed status or not. We have a number of patients that are homeless. I have written off millions of dollars because someone has come into my services in detox or residential, and I've kept them longer just so they can have a place to stay longer after their treatment's completed. I also have a few people that are known to me and my agency that I know need some help, and I will work with mental health and through crisis stabilization or beds we have at, that Crisis has at 180 Place. I've also have a few homeless patients that come in, and I just let them take a shower and get something to eat. So we're here to help. We're here to serve our community and help individuals however we can, in any capacity we can.
Thank you both. So Adina, I'm going to let you know one of the questions was, can attendees get the slides? So if you have a way to send out the slides, people would appreciate that. And then there's one last question, because we have 2 minutes left before our wrap up. And if you guys are comfortable, I will take this question. I believe President Biden and the Democrats gave funding to the states for mental health and substance abuse treatment. I believe SC funding has been held up at our state level. If that is true, how can we help get more funds for you? So SAMHSA is the body by which money for mental health treatment and substance use treatment gets sent down to the states. So State DAODAS, which is the state alcohol and drug agency that receives the block grant funding from SAMHSA, they receive that money, and then they filter that money to the county authorities. Dr. Funsell, there are 32 county authorities, is that correct, to cover all 46 counties? So that's how that money comes down. And how it comes to the mental health centers is a little bit different, but not a ton differently, but a little bit differently. It comes to the Department of Mental Health, and then the Department of Mental Health filters that money down to the 16 mental health centers that cover all 46 counties. Those mental health centers belong to the Department of Mental Health. So that is how that happens. Now, over the last 2 years, there have been some additional dollars, again, coming through the block grant, through the CARES Act, and through the ARPA funding. And if y'all ask me what ARPA stood for, I've forgotten. I try to forget about everything related to COVID. So that was additional money that has come down through the states. There is definitely talk about more state money, more federal money coming to the states. We'll see where that goes. I know, Dr. Francel, do you want to just talk a second about the settlement money? Because that's interesting money also.
Yes, and so ARPA stands for American Rescue Plan Act. I'm kind of nerdy like that. So as Deborah just mentioned, there's settlement money related to the opioid epidemic, and South Carolina, I believe, got $360 million to be spent down over 18 years. And Charleston County is getting 3.8% of that, cities getting 2.3% of that, and other jurisdictions such as Mount Pleasant, James Island, Hanahan, Somerville, some of the other jurisdictions will also get a percentage of that funding. They have to apply for that funding through a state-appointed, governor-appointed committee to draw down those funds. And there's also going to be a discretionary pot of funding as well for 501c3s and hospitals and other organizations and entities to apply for funding. But it has to meet criteria related to some specific challenges that have arisen because of the opioid epidemic. So it's post-overdose follow-up, support to our first responders, support for treatment, medications, help for our homeless population related to opioid use, getting out as much Narcan out or fentanyl test strips or syringe service programs. So they're enhancing peer support specialists. So all of the use of those fundings have to go be centered on those issues that need to get solved in communities as a result of this horrific opioid epidemic that has hit us. And so we are in planning discussions with county and mayor and law enforcement and ACT Force, and working on a plan for requesting funding to support the work that we all do in the community. So that will be a huge benefit for our patients and citizens in our community in need, and also will include prevention work.
Thank you, Dr. Francel. And what attendees can do is you can look at the state budget requests sent to the General Assembly for both state DOTUS and DMH, the Department of Mental Health, and you can let your local legislators know that you support those requests, because not only do these two agencies receive federal dollars, they also receive state dollars from the General Assembly. So, when those the first budget proposals are due to the governor's office, the executive budget office, on September 23rd. And then those budgets will be made public, and you can see what the requests are, and you can help support those requests with your legislators. So thank you for asking that question. All right, now it's time to turn over to our fearless leader, who is Ellen Steinberg. You heard Chairman Pryor talk about Ellen's amazing credentials related to now being the new executive director of the Charleston County Criminal Justice Coordinating Council. We're all so thrilled to have Ellen in that role. She's definitely going to pick up where Christy Danford left off and run with the ball. And we know she's going to do a great job. So Director Steinberg, kicking it to you.
Thank you, Deborah. Can you see me?
Yes, ma'am, we can see you and we can hear you.
Perfect, because I cannot. This has been absolutely outstanding program. Each and every one of you have done such a great job. Debbie Blaylock as moderator, you took it, you ran. County Council Chairman Pryor, I know he's not here, but we're so grateful that he came on. Jennifer Roberts, thank you, as Executive Director of Charleston Dorchester Mental Health. Dr. Shonda Funsell, Executive Director of Charleston Center. Each of you gave us so much information. And as the chairman said, we're so proud of what we're doing here in Charleston. We have so many services. And I just kind of want to wrap it up and bring it in that you're wondering, why is the Charleston County CJCC doing this program? Let me remind you, our mission exists to assist in making sustainable, data-driven improvements to Charleston County's criminal justice system and thereby improve public safety and community well-being. All of these agencies do that. They lift up public safety and community well-being. We are very, very proud of what's happening in Charleston. To everyone who's joined us, if you have any questions, any follow-up, we are delighted to work with you to answer any questions. I thank you all for being here with us this evening. Does anyone have any last comments before we close out? Guess not. All right. I wish everyone a safe and happy evening. Thank you very much.